What are tumor markers, and how do they track testicular cancer? Imagine a tiny biological fingerprint that can tell us if cancer might be present or changing inside the body. That's essentially what tumor markers are. They are substances, often proteins or enzymes, that can be found in higher amounts in the blood, urine, or tissues when cancer is present. In testicular cancer, the most important tumor markers are human chorionic gonadotropin, alpha-fetoprotein, and lactate dehydrogenase. These markers are produced either directly by the cancer cells or by the body in response to the cancer's presence. It's important to understand that tumor markers are not used alone to diagnose testicular cancer. They are part of a bigger picture that includes physical exams, imaging tests, and tissue analysis. For example, if a man has a lump in his testicle, doctors will usually perform surgery to remove the affected testicle and examine it under a microscope. The tumor markers help support this diagnosis but are not definitive by themselves because they can sometimes be elevated for other reasons. Tumor markers are especially helpful in understanding the extent of the disease. For instance, high levels of alpha-fetoprotein and human chorionic gonadotropin often suggest the presence of certain types of testicular cancer called non-seminomatous germ cell tumors. In contrast, pure seminomas may cause elevated human chorionic gonadotropin but usually do not raise alpha-fetoprotein. Lactate dehydrogenase, or LDH, is less specific but can indicate how much tumor is there or if the disease has spread. Monitoring these markers over time is another key role. During treatment, doctors measure tumor marker levels regularly. If the levels go down, it usually means the treatment is working. If they stay the same or go up, it might suggest the cancer is not responding or has come back. This helps doctors decide whether to continue, change, or stop treatment. Tumor markers also guide treatment decisions when a biopsy isn't possible, such as when cancer has spread and causes severe symptoms. In some cases, doctors may start chemotherapy based on marker levels before surgery. After treatment ends, ongoing monitoring of these markers can catch any early signs of recurrence, so intervention can happen sooner. In summary, tumor markers like human chorionic gonadotropin, alpha-fetoprotein, and lactate dehydrogenase are vital tools in managing testicular cancer. They help with diagnosis, staging, tracking how well treatment is working, and catching recurrences early. But it's always important to interpret these markers alongside other clinical information and imaging results. Remember, every person's situation is unique, so always consult healthcare professionals for personalized advice. These markers exemplify how biochemical clues can help make cancer care more precise and tailored to each individual.